AM Tampa Bay, Ryan Gorman in for Jack Harris with Aaron, Jeff, and Natalie. And joining us in studio right now, we have Dr. Ashraf Hanna. And you can find out more about everything that he's up to at ivketamine.com. Doctor, how are you?
Good. How are you?
Thank you so much for coming in. So I'm fascinated to learn a little bit more about this because one of the benefits of your treatment is assisting with PTSD. And we've been seeing some really alarming numbers recently among veterans and even active duty members of the military in terms of depression and suicide and things like that. Kind of step us through how this process works.
Well, I mean, according to the National Institute of Mental Health, ketamine has been the most significant recent advance in mental health in the last 50 years. Patients with depression had nothing in the past but antidepressants, SSRIs, and all those, chemical mediators medication. But nothing really has been that effective. And you have 30% of those patients fail all those modalities. Now with the ketamine, recent studies have shown that it can actually help suicidal ideation within hours.
Wow.
And large studies in lots of universities have shown that a lot of the symptoms of depression, anxiety, PTSD, suicidal ideation have significantly improved after ketamine infusions.
What is ketamine?
Ketamine is an anesthetic. It has been used for many, many years.
Now, we've heard people that use ketamine for different reasons, right? Anytime there's something that can help people, people will abuse it. How can you make sure that there are no negative impacts when it comes to veterans or anybody using this type of therapy, ketamine, IV therapy, making sure they're not using it in a negative way?
Any medication can be abused in medicine in general. So the only way to prevent it is proper selection of those patients and proper monitoring. All patients that we give ketamine for are monitored very carefully with urine drug screens, and we follow them very carefully.
It's not something that they would be doing at home. It's something they would be doing at an office, at a doctor's office.
Well, we start at an office, but in order to reduce the number of infusions, we have actually been providing them with some help with ketamine troches or lozenges, and these are very, very sparingly that we give it to them, just to help prevent them if they're at home and they get a severe suicidal ideation, so they can take it and it can help them. And we always recommend that when they come in, they have their spouse or significant others with them to help monitor them.
Mm-hmm. And if people want to find out more about this treatment and about what you offer in terms of services, ivketamine.com will be the website to go to?
Yes.
Dr. Ashraf Hanna, again, ivketamine.com. Thank you so much for coming in and kind of laying out what that's all about. And it could be an option for those out there suffering from PTSD.
Absolutely. Yes.
We appreciate it.
Sure.